I'm Dr. Samuel here at Montpelier Family Dentistry, and we get a lot of questions here about dentures. So today I'm here to answer questions that are common and help you have better understanding of what dentures are. Dentures are tooth replacement for people who are missing teeth. It's basically acrylic and plastic. It's something that you can take in and out of your mouth. The type of dental professional you would see about getting dentures could be a general dentist or even somebody called a prosthodontist. They just do dentures. A dentist would recommend getting dentures if you have multiple missing teeth on either the top or the bottom. Some alternatives to dentures would be dental implants, a bridge. A bridge is something that you have placed in your mouth that cannot be removed. It's when you have teeth on either side and a missing tooth in the middle. There's like two caps here and then a connected cap in the middle. That's a bridge. A dental implant is something that's placed inside your bone in your jaw, and that is also non-removable. What type of dentures? There are different types of dentures that are out there. There's something called a complete denture, where if you're missing all your teeth, you don't have any teeth on the upper or on the lower, then you need a complete denture. It replaces all your teeth. Another type is a partial denture. I have a sample right here. A partial denture is when you're just missing some teeth, not all your teeth, so it's partially replacing your teeth. Another type of denture would be something that connects to an implant, so that does not come out. It's screwed into the implant and connected. Only a dentist could remove it. And then another type is called removable denture. Any denture that's not an implant denture is technically a removable denture. Dentures are made at the dental lab. There's certified dental labs that make them. They're made out of basically plastic and acrylic, and it's several steps that go back and forth with the lab where they fabricate it. So when a denture is placed, it actually needs several steps before it's placed. The first, some records are taken, like moles of your upper or lower jaw, wherever you're missing teeth. And then there's try-in appointments, detailed impressions, basically 5 total steps. The 5th step being delivering your actual denture, where we put it in, make sure there's no sore spots, make any adjustments to your bite, and then we usually bring you back 1 week after to make sure everything's fitting well. Just getting the dentures fitted for them, all the records, none of that is painful. If you're already missing teeth and no teeth have to be removed, then that part, just getting the actual denture in your mouth, is not painful. You could get sore spots once you wear them for about a week. We make sure to adjust all of that with our 1 week follow-up. So any anesthesia needed for denture placement, really not necessary unless you're getting any teeth removed. Just putting the denture in your mouth and trying it in does not require anesthesia. What should you expect your dentures to look and feel like? I do have a sample here. This is the partial denture. So if you had front teeth and you're missing back teeth, then this would come out and go in. There is a metal skeleton for partial dentures. If you're missing all your teeth, this metal part is not there. It's just all plastic. The partial denture will have a metal skeleton and parts that hook onto whatever teeth are remaining. A complete denture would replace all of this, and it would also cover your roof of your mouth. Is it more difficult to speak with dentures? If you've never had any dentures before, and you have an upper denture, yes, because there is something covering the roof of your mouth, but it is something that you can get used to. While having dentures affect my ability to eat and drink regularly, drinking should not be a problem, but yes, eating will be different with dentures. They're not like your regular teeth. You do have to get the food into 2 pieces and kind of put them in the back where your back molars are and bite like an up and down motion. When we chew, we move our jaw side to side. That, unfortunately, is not a great movement with dentures because they can kind of move a little bit. From biting up and down, that's what we recommend. What is the best way to clean and care for dentures? So this option is called Polydent. You can get it from the dentist. We give it to all our patients who have dentures, or you can get it from the store. Basically a little tablet that dissolves in water, and you can soak your denture in there, and it really helps to get off any buildup. What special care do you have to take afterwards for your mouth and gums? After you get your denture. So you want to make sure you keep your denture out while you're sleeping. You would never sleep with a shoe on your foot. That's a similar thing. You would never sleep with a denture in your mouth because it presses up against your gum and doesn't allow it to breathe. You can end up with something like a yeast infection in your mouth, which is not very pleasant. You want to make sure you keep the dentures clean, and then you want to make sure, even though you don't have teeth or whatever teeth you do have, make sure you keep those clean. You can use like a warm washcloth to kind of rub your gums where you don't have teeth to make sure there's no food debris sitting on there. How long do dentures last? It really depends on how well you take care of them. Coming in, getting them clean professionally, we can do that here. Cleaning them at home, making sure you don't drop them. I've seen patients who had dentures for 10 to 15 years. If your denture needs restoration, replacement, or repair, you can always bring it in. We have a really good lab we'll work with, and they can always help us replace missing teeth, match the teeth that are in there, fix the chipped tooth. They've done great work. How long will it take for your mouth to heal and get used to dentures? Well, again, it depends on each person. If you've had dentures before, it may just be, something just a little bit new to get used to. Never had dentures before. It may take a week or a few weeks just to get used to how to chew and bite and any sore spots, getting those adjusted. Say for a few weeks, nothing more than that. What are the cost of dentures and will insurance help pay for them? For the most part, yes, most insurances do help you pay for dentures. So if you have any questions about the cost, we were always here to help answer your questions. When should you schedule an appointment for dentures? If you have any questions about missing teeth and your options, schedule an appointment now. So I hope we've been able to answer any questions that you had. If you have any more questions, feel free to call us here at the office at 301-604-0025, or you can also visit our website at thelauraldentist.com.